Hey, I'm going to get us started. My name is Emily. On behalf of Season Health, I'd like to welcome you to today's webinar, a Dietitian Roundtable. Know that this webinar is being recorded, and the recording will be sent out to everyone after the event. For those of you who may not be familiar with Season Health, Season offers personalized nutrition programs that help you learn to eat healthier without giving up the delicious food you love. We provide virtual visits with a registered dietitian, tips and guidance on nutrition, how to navigate health conditions, and cooking. We bring thousands of chef-created recipes to your fingertips with affordable pre-made meals. And on our one-of-a-kind app, we help you stay on track. Before we get started, just a few things to review. We are going to allow you to submit live questions throughout the session today. Use the Q&A icon at the bottom of your screen. Sometimes it does show up at the top, but you'll see Q&A. We ask that you participate throughout the entire program. It's okay to respond in the chat with your thoughts and ideas. As long as you're comfortable with participating that way, we encourage you to share. We'll answer as many questions as time allows. If we happen to not get to all of the live questions, we plan on following up with those questions in an email. And as you're probably aware, audio and video have been disabled for all participants. If you have any issues, once again, please use the chat to let us know and we'll help you out. All right, let's go ahead and get started. So today we have three panelists, myself, Emily Nischberg, Amanda Bowen, Marcia Schultz. We're all here to answer your questions. We are all registered dietitians, and we also all hold a specialty certificate in diabetes. Today, we're going to start with previously submitted questions, and then we'll turn to questions that have been submitted live. We may also, if we have time, review some common questions that often come up during our sessions. And as a reminder, we do want to hear from you. So make sure that you use the chat to weigh in anytime with your ideas, your thoughts, or additional questions. All right, so we're headed into our first question. I'm going to turn this over to Amanda. She's going to review this first submitted question.
Thanks, Emily. So this first question, I believe, came in specifically around kefir and whether it contains lactose. But we also wanted to expand on this to touch on lactose intolerance as a more general topic. So yes, dairy products do have lactose. Kefir is dairy, so it does have some amount of lactose in there. However, not all dairy products are the same. So this chart is really helpful to see that some products are higher in lactose versus others. Things such as kefir or even yogurt, they do contain cultured bacteria. So although they do contain lactose, a lot of times they are well tolerated by people who may have lactose intolerance. And then things like butter and, ice cream, different types of other dairy products, will still contain some. But if you're sensitive to these products, then of course, pay attention. Not everyone has the same level of tolerance for certain amounts of lactose. And I would just listen to your body. If you know something doesn't agree with you, best to avoid it. And then there's also non-dairy options for almost everything on this list. So there's now non-dairy milk of all sorts, plant-based milks, even things like cheese and yogurt you can now get in plant-based forms. So there's a lot of options out there. But yeah, if there's any other questions, hopefully you are with Season and you can ask your dietitian for more help.
And just a reminder, feel free to weigh in on the chat. So we want to see that chat really active. All right, moving on to the next question here. Marcia.
Yeah, thanks, Emily. So what is a healthy approach to eating if you have prediabetes or diabetes? We at Season and as registered dietitians love to help explain the plate during our sessions. So specifically for diabetes or prediabetes, this is a great visual to look at and help mimic when you are planning meals. So Half of your plate should be non-starchy veggies. These could be maybe a salad, or maybe you like broccoli or cauliflower or zucchini, anything along those lines. So visually, right, half of the plate should consist of that. And then the other half should consist of carbohydrate containing foods and proteins. So proteins would be your eggs, or it could be some cheeses, or it could be, fish or chicken or turkey or beef, whatever your preference is there. And then the last section, so the quarter, should be some type of carb containing item. So this could be potatoes. Yes, even if you have diabetes, you can have potatoes, white or sweet. It could be bread, it could be rice, it could be pasta, it could be any type of fruit even. There is a wide variety of things that can, go in this section. So kind of think of this when you're planning your meals. Example, right? Let's say for dinner tonight, you plan on, grilling some chicken, right? That would go in the protein section. Then let's say you want to have a baked potato, that would go in the carb section. And then, you're going to have a nice salad with a ton of veggies on it. That would be a really simple, easy meal following this plate, and still able to help control blood sugars in this way. So, yeah.
All right. Thanks.
Let me know if you have questions. Thank you.
That plate method can be a really great tool for meal planning as well, right? So as you're putting your meal together, just looking at it and check, just like you said, just check marks in all of those areas. All right, I do want to acknowledge that we have some of those Q&As coming in. So we have 2 live questions coming in, and we're going to get to those in just a moment. This question is around the nutrition facts label. So in the chat, I'm going to ask you, if you feel bold to respond to this, how many of you can find at times the nutrition facts label confusing? And if you do find it confusing, is there an area on the nutrition facts label that's especially confusing? So as you're putting into the chat, I'm going to go ahead and go through this question. So on the food label, does total carbohydrate listed include the sugars and the added sugars? So let's turn our attention to the image on the screen. This is an example of the food label. Total carbohydrates does include sugars, all sugars, including added sugars and natural sugars. So sometimes when I'm explaining this, I will explain that in the indented part, if it's indented, it's part of the above non-indented. So you see dietary fiber is indented, you see sugars are indented. Those are already part of that total carb. So if you want to know the entire story of how much carbohydrate is in a food, you're going to look at total carbohydrate. So an example would be if I only looked at sugars, I would not get the entire story of how much total carbohydrate is in this food, right? So sometimes, again, an example I'll use is Cheerios. So if I look at Cheerios and I want to know carbohydrate, maybe I don't necessarily need to know sugars, but I look at total, if I just look at sugars, I see 1 gram. If I just look at sugars and I see 1 gram, I would think, oh, well, this isn't going to affect my blood sugars very much. But if I stop at that total carbohydrate line, total carbohydrate in Cheerios is actually 22 grams. So there is some differences there. If you're looking to see how much a food is going to affect your blood sugars, total carbohydrate is a really important line. The sugars can be important. You don't have to look at it, but sugars does that sugars here, 12 grams does include natural and added. And then right below sugars, you can see where it has added sugars. So this is a fairly new addition to the food label. This is, again, the added sugars does not include natural sugars. It's just those added sugars to sweeten the food. So does anyone know, has anyone heard of the guidelines of how much added sugar you can have in a day? Curious. I'm looking at the chat to see if anything's rolling in. So American Heart Association sets a guideline of to keep it below 24 grams of added sugar per day. Marcia, Amanda, did I miss anything there? Okay.
Well, that's a great answer. Also, it's important to look at the serving size too, when you are kind of looking at everything, specifically for blood sugars.
Yeah.
Mhm.
Yeah. So, well, for all of them, right? So if you were thinking about where do I stop first, maybe it is that serving size, because all of the numbers on this label are specifically talking about that serving size that you see at the top. Thanks for that reminder. Amanda, anything on your mind that I didn't touch on?
I think you touched on everything. Yeah. The total fiber, sugar, everything is included in that total carbohydrate, and similar to the fat content. I know this question was about carbs, but the saturated fat, trans fat, everything will be included in the total fat at the top. So that's also something you're looking at.
Thank you. All right, moving on to the next question.
All right, I will take this one. So I have so many restrictions. I feel like there's nothing left to eat. How do I fix this? And I think this could apply to so many different types of scenarios. This could be a specific nutrient restriction like vitamin A or vitamin K if you're on certain medications, or if you have a condition like any kidney problems, you need to be aware of phosphorus and potassium intake. So when it comes to these, one, I would say, of course, speak with your doctor, speak to your dietitian. They're going to help give you the most individualized recommendations for these based on your blood work, your condition, because it's not going to apply to everybody. The other I would say is if you're feeling like there's so many foods you have to take away, think more about what you can add more of. If you're maybe high in a certain amount of food, certain nutrient, and you have to limit that, maybe there's something else that could be added. So I would focus more on not necessarily what can't I eat, but maybe what could I eat more of? And basing your shopping list when you go to the store around that. Or similar to like we saw in that chart with the lactose content, maybe if there's a specific vitamin or mineral that you have to limit, not all foods contain the same amount. So some will be higher than others. Maybe focus on minimizing how often you eat those. And the ones that have, say, a little bit of vitamin A would be okay to have every once in a while or a smaller portion. So that way you don't feel so overly restricted. But always defer back to your doctor or your dietitian for the best care for you.
Okay, thanks, Amanda. Next question. How can we stick with healthy eating and not cheat?
Great question, Emily, or whoever submitted it, right? So when it comes to healthy eating and cheating, I like to encourage everyone that I'm working with to really think about what does healthy eating mean to you? And maybe instead of thinking of it as a cheat day or however you want to phrase it, kind of flipping that script and getting curious around what are some of those foods that you feel like you maybe overindulge in or feel like you can't have, and then hence you're feeling like you're cheating, right? So getting really curious around what those foods are, and potentially maybe even triggers, right? So what are some triggers that are you skipping a meal later in the day, and then that makes you want to choose something that maybe you hadn't planned for later on the day that would be considered a better option. So healthy eating is very subjective, right? And staying on track also in regards to all of this. I always encourage my patients to understand like what that means to you and why are we working on excuse me, why are we working on X, Y, and Z? What is your reason why for wanting to stay on track and stick with the plan that you have developed for yourself with your dietitian or anyone else? So yeah, I could go on and on and on, but that's the short version. Anything else anybody wants to add?
Yeah, sometimes I'll bring up this concept of curiosity over criticism. So we have these moments where we feel like I cheated or I failed. Like you said, Marcia, how do I shift this to looking back and seeing what caused this? So I'm going to be really curious about the situation that made me overeat or made me feel like I was off track. and maybe cheating. I'm, asking like what was going on here. So shifting that mindset from criticism into curiosity mode. All right, this is the question I'm going to take. How late can you eat before bed? All right, so this will be an interesting question because we may all have a little bit different perspective on this. If someone asked me this in session, I would probably say, oh, tell me more about this question. Give me an example of what's going on, or where you are curious about, can I actually eat whenever it's 10:30, 11 p.m.? And the short answer would be, you can eat anytime that you're hungry. The tough thing is tuning into hunger. So sometimes we haven't practiced tuning into hunger. It's not something that we're used to doing all the time. So let's say it is late and you're really feeling inclined to ask that question. Can I or can't I eat? It's late. I'm not sure if I should have this snack, or gosh, it's after 7 p.m. and I haven't had dinner yet. Do I go ahead and have dinner, or do I just skip dinner? Tuning into that hunger is really important. So if you feel a physical sensation of hunger, yes, it's an okay time to eat. If you stop and pause and you're asking yourself, where am I in terms of hunger? And your answer is, really, I'm not that hungry. You may start asking yourself, what is it that I really need? So if you find out I'm not actually hungry in this moment, I'm headed to the kitchen for my bedtime snack, I've paused, gosh, it turns out I'm not really hungry. You can ask yourself, what is it that I really need? And your answer can be lots of different things. It might be, I'm really tired. It's just time to turn in, right? Or, hey, I'm feeling bored. I've been sitting for a long time. I just needed to get up. Maybe I need to change activities. Maybe I need to head outside, get a nice dose of fresh air, whatever that may be. But asking that question, one, where am I in terms of hunger? And two, if I'm not hungry, what is it that I really need? I think the second part of answering this question might be like, if I am hungry and it's late, it's kind of considered this bedtime snack. What makes a healthy bedtime snack? Lots of times I'll answer this in terms of blood sugars. I know everyone on here may or may not have diabetes, but I think this is a good approach for any bedtime snack. Often I'll use this idea of pair it with protein, right? Because that can help manage blood sugars throughout the night. If we add some protein to our bedtime snack, it can also make us feel fuller if we're adding some protein to that bedtime snack. So I might think of an apple, pair it with protein. Maybe I will have a small handful of almonds or some peanut butter with that apple. Or I'm choosing a whole wheat piece of toast. How can I add protein to that? Again, maybe I'm adding peanut butter, maybe I'm adding some cheese, but really pairing that carbohydrate, pairing that fruit or that whole grain with protein. That can be a nice way to have a bedtime snack. All right, anything else to add or any questions on that in the chat?
I would just like to add, Emily, I think those are great tips, but it is also helpful to keep in mind maybe certain health conditions you have. So if you have gastroesophageal reflux disease or any problems, we wouldn't want to eat so close to a time where we're reclining or lying back. That could make it more difficult to digest the food and cause more discomfort. And then also if you have problems, with high triglyceride levels or high fat levels in the bloodstream, anything that we're not using for energy within the first 2 to 3 hours after we eat does tend to get stored as fat. So I would also keep in mind if there's certain health issues that you're trying to manage, again, discuss with your dietitian and they can help you plan around eating before bed a little bit.
And that's the beauty of season, right? There will always be these questions around nutrition and situations. What am I supposed to do? And really turning to your dietitian, because these can be these are individualized answers, right? Depending on health conditions and situations. All right. Okay, so it looks like we're on our last submitted question that came in early before the webinar. And this is, what are some season strategies or just some overall strategies for eating healthy on a budget? And I see that is also a comment in the chat, right? Feeling like one of the overwhelming parts of eating healthy can be the price tag associated with it. So we're going to answer this question. All of us are going to answer the question, share some of the tips and tricks that we use in our own lives But also just want to call some attention to some things on the Season app. So 2 things on the Season app or the website, whatever you're using, you can see the cost per serving. So if you look at this screenshot here, the cost per serving going across these examples, one is $5.95 per serving. The next one is $2.50 per serving. So if I'm looking at that, I can see some of the more budget-friendly recipes on Season. And then also, if you check into the Season, if you click on recipes, you're going to notice that there are different sections in the recipes. So there is a section as you scroll down called Bites on a Budget. And all of those recipes in that section are going to be very budget-friendly, healthy recipes. All right, so I have some tips that I'm gonna hold off on my tips. I want to hear from Amanda and Marcia. What are some strategies you use for healthy eating on a budget?
So I'm a huge advocate for, the frozen section when it comes to, fruits, vegetables, things that maybe tend to go bad quickly if we're buying them fresh, and a great way to get things that are not in season. So I think that can also save a lot of money and time, money with food waste. If we buy, a head of fresh broccoli, may go bad and we may throw it out, versus some frozen unseasoned broccoli we can go to anytime we need it. It's already cut, prepped for us. We really just need to cook it up and season it. And then if you tend to do your shopping at the same stores, look into when they post their coupons or when they post their sales, if they have any sort of reward benefits program. If you tend to shop there frequently, then it could be worth, signing up for any of those, or, getting their coupons in the mail, planning your shopping list in advance, and, just having a plan, what you absolutely need, and then do your best to really just stick to the essentials. Going shopping without a list does tend to get very expensive because we start adding on everything that looks good. But if we know what we need, then we can budget out and plan a lot better.
Thank you, Amanda. Marcia, what's on your tip sheet?
Yeah, I'm going to piggyback off of what Amanda had just said. And that's the exact reason I do not bring my husband to the grocery store, because he will grab everything. So like I said, to piggyback off of what she had just said with making a list, something that I have been doing for a while now, to make sure that I'm not going over budget. We all know food costs continue to rise and rise, is I will plan out my made items for the week. So maybe I'm having, some burgers or tacos or who knows, whatever I'm having for the week. I'll plan out the main meal, make a list. And then I continue to add to that list, because then every time I'm about to go to the grocery store, I look at my list that continues to get longer and longer. And then I'm like, oh, I want this week. Oh, I want this week. And then I'm able to make my list of ingredients that I will need. And then the main tip right here is to plan things that have very similar items. So like example, if I'm going to buy a huge bag of kale, right? Maybe I'm going to have some type of salad, and then maybe I'll incorporate some type of soup or something that week that also incorporates kale. So I'm piggybacking off of groceries or ingredients that, complement each other and use the same thing. Maybe it's peppers, right? Maybe I'm going to do some kebabs, but then I'm also going to do some fajitas, right? So making your list and then piggybacking off of ingredients has been something that has been really helpful. Yeah.
That reminds me, so you're talking about having one ingredient, using it multiple times. So when you're thinking like, I don't know, I'm going to make peppers with my fajitas tonight, but I need another idea for peppers. Remember, in the Season app that's now available to everyone, you can go in and search the recipe or search the ingredient and find many recipes that have that ingredient in it. So if you're stuck on, I know what I'm doing one night, but what will I do the next night, or how will I reuse this ingredient? You can search that.
Great tip, Emily.
Thank you. So I'm thinking as a mom and I have 4 kids at home, and thinking like, how do we stay on a budget? And as Marcia said, and Amanda talked about, is this our prices are rising and rising. And so everyone, I imagine, is in a similar situation thinking, everyone has a food budget. How do I stick to my personal food budget? I really do encourage everyone to shop more frequently than once a month, right? So sometimes when I'm talking to patients, they are shopping just once a month. But if we shop more frequently, weekly, we are exposed to more sales. So, and fruits and vegetables can be that sometimes feel like that limiting thing in terms of cost. So if you're shopping weekly, you're exposed to more sales, more variety of sales on those fruits and vegetables. So I do encourage people to try to do it weekly. The other thing that I do certainly aligns with what Amanda's talking about. I use an online grocery app and look at their deals, use their online coupons. I tend to buy from that specific grocery chain what's on sale that week. And then I buy my other ingredients at a store that just tends to have lower prices overall. So I get the lower price on the non-sale items. And that's what I tend to do. But also stock in that freezer with frozen veggies, because that is definitely a way to save on vegetables and adding more vegetables. In the chat, we'd love to hear what you're thinking. What's a strategy that you might use or you do use, and it's a tried and true way to save money when you're eating healthy on a budget. All right, so we're getting down to the final minutes of the webinar, but we do want to give a little time. So definitely let those ideas come in on healthy eating on a budget. But we do have 2 questions in Q&A. So I'm going to start with the one that came in first. That is, can you explain sugar alcohols? Does anyone want to take that? I mean, I can take it if I would just say it's another way to sweeten foods that isn't traditional added sugar. It's not a non-nutritive sweetener. It's just a sweetener that we use less of. So I'm trying to think of an example. The first one that comes to mind is xylitol. Well, I don't know what else comes to Marcia and Amanda, what comes to your mind, but it's, ends in an OL. Sugar alcohols can be used a lot in sugar-free foods, right? So you see it in sugar-free gum, you see it in sugar-free candies, sugar-free cookies. What else? If I'm missing something.
Yeah, I think erythritol can be used in baking quite a bit as like a substitute for granulated sugar.
So a lot of people use it. A lot of people use it and tolerate it well. Also, a lot of people use sugar alcohols or buy products that have sugar alcohols and don't tolerate them well. So sugar alcohols can cause a lot of gastrointestinal stress, diarrhea, gas, bloating. So if you have some of those sugar-free products and you're thinking, what the heck is going on? Why am I not tolerating that? Sometimes it can be those sugar alcohols.
And then just one more thing to add. And if whoever submitted it wants to elaborate, if you do have diabetes, they could be, a good alternative to things that have maybe a little bit more added sugar in them. They don't, raise your blood sugars, but again, use in moderation due to, all of the side effects that could potentially happen. So
that makes me also think, Marcia, when you brought that up, is like, yeah, they, in products, they can lower that total carbohydrate content. But you never know until you look at the food label. So going to that food label is really where you're going to find the facts of, does this sugar alcohol actually lower the total carbohydrate amount? I'm always amazed that sometimes whenever I'm flipping that package on a product that says lower sugar or no sugar, and I flip it and I can see that total carbohydrate, that's the place to go to get the full answer of how it's going to affect your blood sugars.
Sugar-free ice cream is a great example of that.
Yeah. All right. Next question here is, I have prediabetes and high cholesterol. How do I eat for both of those?
I'll start off on this one. I think that's a great question. It can feel like a lot of health conditions have different ways of eating. However, a lot of these conditions like high cholesterol, diabetes or prediabetes, even high blood pressure, there's not really any exclusion between those. A great way of eating that addresses most of those is including more whole grain products, more fruits, more vegetables, more plant-based proteins and plant-based fats. So I don't think it's necessarily about trying to balance what's recommended for one and what's recommended for the other, but a lot of times there's quite a good overlap. So just trying to find that overlap can feel difficult in the beginning, but it is there. And again, that's where I think the Season platform can be helpful, because you can put in all of your health conditions and you'll get customized meals and recipes that do align with your goals and what you're looking to manage.
The plate method that we looked at earlier, that's a really great approach, right? Making your plate look like the plate method aligns with diabetes, pre-diabetes, high blood pressure, high cholesterol. It's a really strong foundation for healthy eating for many health conditions.
And going back to what can I eat, right? What should I have more of? Is another great way to really look at and frame this, as opposed to what I can't have, or what did the, so-and-so say I can't eat. Incorporating more of those good whole foods, like Amanda and Emily were talking about, is a great way to think about it. And then meeting with us, right, for us to debunk and kind of clarify and make it a little bit more clear for everyone.
Yeah, that's definitely the beauty of Season. I bet everyone here is wanting, we gave some really good answers, some basic answers, a good foundation for some of these questions, but you all have unique situations. And so we just want to encourage you to talk to your dietitians, and we can come up with individualized answers for some of these. All right, so we've answered all of the prior to the webinar questions. We've answered our live questions. We're a little over on our end time, but we do want to just bring your attention to marking your calendars for December and January for our upcoming webinars, and knowing that we host a webinar every month. In December, we're going to be tackling the subject of healthy holidays. In January, a fresh start to the new year. We will determine dates in just a handful of weeks, I'm sure, for the December webinar. Stay tuned to your email. We will email out the specifics and the registration for those upcoming webinars. We want to thank everyone for joining us today, and all of those who may be joining us later as you watch the recording. We also want to make sure that if you're not enrolled in Season right now, or if you have friends and family who might be interested in Season is available to everyone. And all you need to do is visit seasonhealth.com and click on Get Started to sign up. Hope you all have a lovely afternoon. Thanks for giving us your time. We each hope to see you in an individual session soon. Take care. Bye-bye.